There is growing concern about the disproportionate number of Black and African Americans dying from the coronavirus. Governor Cuomo revealing today African Americans represent 28% of the deaths in New York City. It's more dire here at home. Take a look at this. One of the largest clusters in Erie County is in the 14215 zip code, where there are now 100 cases. In Erie County, 33% of the deaths are in the Black and African American community, yet Black people make up just 14% of the population. 7 Eyewitness News reporter Madison Carter explains how the city of Buffalo is responding to the influx of cases on its Upper East Side.
Mayor Byron Brown says it is all hands on deck when it comes to addressing the high number of COVID-19 cases in the 14215 zip code. Brown says attacking health crises in minority and low-income communities is a little bit different. He says in these areas, people aren't necessarily looking to elected officials. It's block club and religious leaders that have the most trusted voices. Accessible information is key.
As we've gotten information from the federal government, the state government, the county government, we've tried to synthesize that information, make it easier to understand, and we've provided that information throughout the city of Buffalo in a variety of different ways to all of our residents, certainly doing that in the most impacted areas of the city.
Brown says it's also important minorities who are working in low-wage jobs that are in dense or high-contact environments get proper protective equipment. These are transportation workers, people in grocery stores, delivery and warehouse workers, and home health aides. Erie County plans to expand testing to these workers and is in the process of securing more personal protective equipment for them as well. So why is this a conversation about race? COVID-19 can affect anyone, that is true. But in the 14215 zip code, 80% of the people there are Black and 26% of them live in poverty. These people don't have a primary care physician, most of them. They can't afford co-pays or regular checkups. They can't afford medications or visits to the hospital. They also don't have any fresh food nearby, and there isn't a gym within 10 miles of most places within that zip code. This isn't the case in wealthier and whiter communities. It took just 3 days for the number of COVID-19 deaths in the Black community to go from 22 to 33%, and people fear that number will continue to rise. In Buffalo, Madison Carter, 7 Eyewitness News.